Did it not stream? Hello and welcome everyone. Thank you for joining us today for the release of our national data set on a national survey conducted on Americans' attitudes and opinions towards preparedness with a special focus on children in disasters. The survey we'll be talking about today was done on behalf of the Resilient Children, Resilient Communities Initiative, which is a 3-year partnership of the National Center for Disaster Preparedness at Columbia University's Earth Institute, Save the Children, and funded by a grant from GSK. My name is Jeff Slugamelch. I'm the Deputy Director here at the National Center for Disaster Preparedness and the Principal Investigator for this initiative. I'm joined by my colleague, Dr. Elisaveta Petkova, who's a Research Associate here at the Center and also the lead author for the report that we'll be going over today. And I'm joined by a colleague, Erin Bradshaw from Save the Children, who leads the community-based initiatives they do and the great work in disaster preparedness and response. For those of us joining live on the webinar, we actually encourage you to be part of the conversation and the discussion today and to submit any questions that you have for the Q&A portion we'll come to later on in the program. You can do this through the YouTube channel live chat box with your Google or YouTube login, or you can participate via Twitter with the hashtag SafeKids, and you can submit your questions that way as well. For those of us watching this as a recording after the fact, unfortunately, we won't be able to get to your questions, but we do encourage you to continue the conversation using the SafeKids hashtag. Before I talk a little bit more about the Resilient Children, Resilient Communities Initiative, I'll give a brief overview about who we are at the National Center for Disaster Preparedness. And my colleague Erin Bradshaw will give a little bit more of an overview of Save the Children and the great work that they do every day in disaster preparedness and response just a little bit later in the program. So at the National Center for Disaster Preparedness, we really work to understand and improve the nation's capacity to prepare for, respond to, and recover from disasters. We focus on the readiness of government and non-governmental systems. We look at the power of community engagement, the complexities of population recovery, and really look at the risks of human vulnerability with a particular focus on children in disasters who are among the most vulnerable populations. Some of the things you see up here with the trainings, the surveys, the preparedness reports, we really work at the intersection of research, policy, and practice. And all of these tools are available free of charge on our website for folks who are interested in more. So when we looked at developing this partnership and being part of the Resilient Children, Resilient Communities Initiative, it was really driven from a lot of the work done previously, where we really looked and discovered that children are the bellwethers of a community's recovery. This came out of research we've conducted on the Gulf Coast in the aftermath of Hurricanes Katrina, the Gulf oil spill, as well as some of the recovery ongoing from Superstorm Sandy in the greater New York metropolitan area. And in layman's term, what it means is that if you want to know how a community is recovering, look to the children. If the children are doing well, the community's probably doing well. If the community's not doing well, the children are not doing well. And there are a lot of different reasons for this, but we theorize that the main reason for this is that children interact with so many different facets of the community. They're under the care and supervision of schools and daycares and after-school programs. There are nutritional assistance programs, clinics and specialty medical care settings. They exist within the emergency management framework. So there's really no single part of a community that determines whether a child is going to do well or not, but it's really a very holistic approach. But too often we find that the unique needs of children are left out of disaster planning, or they're just grouped in too much into a one-size-fits-all approach where that just treats children as though they're small adults, when in fact they have very different needs socially, psychologically, physiologically, that just really warrants a specific level of consideration and a specific level of planning. So with the Resilient Children, Resilient Communities Initiative, we're really looking at taking a holistic approach, recognizing that first and foremost, preparedness starts at the community level. It's the communities where these children live their lives and where individuals reside. And so we're establishing community resilience coalitions in 2 pilot communities in Putnam County, New York, and Washington County, Arkansas. Moving on over to the national level, we also recognize that communities exist within the framework that's set by national policy and national preparedness programs. And so it's really critical that we're able to make sure that there's a connection between what's going on at the community and what's going on at the higher altitudes of the national preparedness dialogues. And in between those two, we really need strong research and strong evidence so that we're able to really develop a model for child-focused community resilience that's ultimately sustainable and replicable across the country. I want to take a moment just to recognize our partners in Putnam County, New York, and Washington County, Arkansas, who are really doing great work to try and create the blueprint for doing this work. And the great work of these pilot communities is really going to develop tools and generate resources for other communities that are looking to do this work as well. So over the course of the initiative, what we really hope to achieve at the local level is to really improve the resilience, the coordination, and the preparedness of these child-serving institutions, because that's really where the children interact with directly. Looking at a cross-sector approach that's sustainable for child-focused preparedness, and really demonstrating this readiness in an empirical way through assessments, through scenario-based exercises, and really taking a data-driven approach to setting priorities and understanding what the next steps are. But beyond the communities as well, too, we recognize that there's really a national need for this. And so taking that and scaling that up to a national model for increasing community preparedness for children, increasing national awareness of understanding. And also, we're also in the process of establishing a National Children's Resilience Leadership Board to really serve as the vehicle for doing this, bringing thought leaders from the research community and the policy communities and the private sector to help look at what's going on in the communities to make sure that they're getting the resources necessary through the existing policies and programs, but also the great work that's being done in these communities is finding its way into the dialogue for the next generation of national preparedness policy and program development. So with that, in looking at the research and evidence base, we realize that there's an important piece of looking at this nationally, and that is that preparedness is really the aggregate of individual behaviors, attitudes, and opinions. And so we've done reports in the past through the American Preparedness Project looking at attitudes and opinions towards preparedness. But we really wanted to expand on that and add a new suite of questions focused on the preparedness for children in disasters. And so in deploying this report, this survey was developed here at the National Center for Disaster Preparedness River in New Jersey. It was conducted from November 30th through December 14th. For those of you looking at your calendars to think at what might have skewed the data a little bit, I'll go ahead and tell you the terrorist attacks in Paris actually occurred 2 weeks before the survey was deployed, and the attacks in San Bernardino, California occurred during the deployment of the survey. So it's an important consideration in understanding the data. The survey was only administered to those 18 years of age or older through a random digit dial method, with approximately 45% of those made up of cell phones. It was weighted by census data, by sex, age, race, and geographic region. We had a sample size of a little over 1,000. The data you're about to see has a margin of error of plus or minus 3%. It's also worth noting that in some of the exception categories of unsure, not available, don't know, refuse to answer, anytime where the aggregate of those was 5% or less, we just lumped them together. If it was 5% or more, we broke them out. And so before we go into that, I just want to provide one more caveat, and that is that a person's attitude or opinion of preparedness does not necessarily equal their level of preparedness, particularly when it comes to their perception of their community's level of preparedness. However, a caveat to the caveat is that attitudes and opinions are still important because they provide insights into how people trust in those response systems, how they're likely to interact with it at all phases of emergency management. And they can be key insights into whether or not the plans that are being developed are actually achievable at the individual level based on existing attitudes and opinions. So with that, I'm going to hand it over to my colleague, Dr. Petkova, who's about to make us all just a little bit smarter about American attitudes and opinions for disaster preparedness.
Thank you, Jeff. And thank everybody for joining the webinar. In this presentation, I'm going to walk you through the major findings from the National Survey Report. You can download the full report by visiting the webinar website and clicking on the report image. As Jeff has mentioned, this is a survey that has interviewed 1,048 households, and the sample is representative of the U.S. population. Some of the questions you're going to see are new, while other questions have been asked in previous years. So the first question that you can see on page 4 of the report, we asked participants if they feel that their household is ready for a disaster or not. As you can see on the chart on the left, 57% said that their household was ready, and 39% said that their household wasn't ready for a disaster. Next question on page 5 of the report. We asked participants if they have a family emergency plan in place that all family members know about. Here we found that unfortunately only half of the population has such an emergency preparedness plan in place. This is an interesting finding because NCDP has actually asked the same question over the years, and we have seen an interesting trend over time. This chart, also on page 5 of the report, illustrates the population trend over time with dots representing data collected in previous years. As we can see, there has been a slow but steady rise in the percentage of the population that has an emergency preparedness plan in place, and we have observed a 15% increase since 2003. When it comes to emergency preparedness plans, it is not only important that families have them, it is also important that emergency preparedness plans are adequate and that they include all the necessary items. We have defined an adequate emergency preparedness plan as including at least 2 days of food and water, a flashlight, portable radio, spare batteries, emergency phone numbers, and a meeting place for family members in case of evacuation. We found that of households with family emergency preparedness in place, or a total of 525 households, 68% had all necessary items. This is also a question that we have asked repeatedly over time, and as you can see here on this chart, there has been an increase in the percentage of households with adequate emergency preparedness plans over time. The chart illustrates the percentages of the population who have no emergency preparedness plan at all, which is illustrated by the orange portion of the bars. Percentage of the population with inadequate plans in place, the light blue portion of the bar, and percentage of the population who have an adequate plan in place with all items present. So as you can see, we have seen an increase in the percentages of people who have any plan, as well as people who actually have adequate plans in place. Another very important question that we have asked is about the population expectations about the response in the event of an emergency. We asked participants the following question. In the event of a major disaster in your community, how long do you believe it will take first respondents, such as fire, police, paramedics, or others, such as the National Guard, to arrive and assist you? As you can see on this chart on the left, over half of the people believe that in the event of a major disaster, help will arrive in under 1 hour. This is an interesting trend as well that we have observed over time. As you can see, the percentage of the population believing that help will indeed arrive in under 1 hour has increased over time. Since 2011, when we last asked this question, we have observed an 18.5% increase. Next, we asked people the following question. In the event of a major disaster in your community, how long would you expect it to take schools and child-serving institutions in your community to reunite children with their parents? We found that over half of the population expressed confidence that schools and other child-serving institutions will be able to reunite children with their parents within several hours. We also found that most people were optimistic about the amount of time schools and daycares will need before they can resume their normal activities. You can see on the chart in this slide that most people expect that schools will resume in less than a month, with 42% expecting that schools will resume within only a week. In the next question, we asked households with children if they knew where their child would be evacuated in the event of a disaster. Unfortunately, we found that over 40% of the population did not know where their children would be evacuated, which is an issue of concern to us. We also asked respondents if they think that their community has an adequate emergency response plan in place in the event of a major disaster. Here we found that only 35% responded yes, 41% responded no, and 24% were actually unsure. And finally, we asked survey participants about their level of confidence in their community's ability to meet the unique needs of children in disasters. We found that respondents had a high overall confidence, and 62% expressed an opinion that their community has the ability to meet the unique needs of children in disasters. Now, I'd like to briefly summarize the findings that I have presented until now. And we, of course, hope that you will read the full report and will find it useful. So, although Americans are more prepared now compared to 2003 when we first started administering the survey, 65% still do not have an emergency plan in place, or the plan that they have is not adequate. We also found that individuals have high expectations for first responders. Over half of Americans believe that help will arrive in under 1 hour in the event of a disaster. We also found that individuals have high expectations for being rapidly reunited with their children and for schools reopening quickly after a disaster. Over half believe that they will be reunited with children within several hours, and over 40% expect that schools will resume normal activities within a week after a major disaster. Unfortunately, over 40% of Americans with children do not know where their child would be evacuated in the event of a disaster. And finally, although people are in general confident in their community's ability to respond to disasters, 41% are not confident that their community has an adequate plan in place, and 37% are not confident that the community has the ability to meet the unique needs of children during disasters. Thank you very much, and I hope you will enjoy reading the report.
And thank you, Dr. Petkova, for sharing with us the detail of the report and walking us through it. I think these are really important findings. I want to talk for just a few more minutes about kind of what this means from a national perspective before handing it over to Erin to really talk about what this means from the perspective of the community and from the perspective of the child. Just as a reminder for folks to use that hashtag #SafeKids as well as the live chat. We'll be monitoring the questions and be addressing those in just a few minutes in our program. So as we look through the different data, what is it that tells us about our national preparedness? And I think what the numbers really tell us is that preparedness among households remains shockingly low. And particularly as we unpack that question of how preparedness households are, to actually look at what kinds of actions are being taken, at 35%, it's just not far enough. We're not moving the needle on this. And so something just isn't clicking the way that we had hoped that it would through the years of preparedness efforts going on. Awareness among parents of emergency plans for their schools or their child caring organizations is low. In developing the report for this, I think a question that we had among ourselves was, what is the optimal level of preparedness? Obviously, 100% is ideal. I think it's 60% are aware. What number would we want to see? I don't know the answer to that, but I know that we're not close enough to it to really have to worry about that. To put that in perspective, if you have a school of 1,000 students and 60% are aware of the emergency plan, that means 400 families are not aware, and that will overwhelm any emergency system for a school that size. And so really, I think we have quite a bit of work to do before really worrying about the precision of what that optimal number is. Interestingly, individuals have a higher level of trust in communities rather than government, and that term used in the survey was simply that sort of generic term, government. So although trust is lower than ideal, it is much higher for trust in communities. Individuals are going to look to their communities for answers and look to their communities for guidance rather than national figures. And really, one of the most interesting things to me was that levels of trust are low, and yet expectations are high. And so this is the paradox, and to me, this is why opinion data is so important, because logically, it doesn't make sense, right? If you don't trust, you don't have high expectations. But in reality, that's how it works, is that people don't have a lot of trust, but they expect responders there within an hour or within a few hours. They expect to be reunited with their kids within a few hours. And so what does this mean, right? What can we do about this? What does it matter? And so in some of the high-level recommendations we've come up with is really at the policy level, is what are our current strategies and approaches to community engagement? We talk about whole of community and community resilience, but what is the actual resourcing of that language? How do we actually help connect communities and to the policy, to encourage that outreach to parents and families in the larger disaster preparedness programs? For emergency planners and emergency managers, what can be done to enhance the participation of both families and households, as well as those child-serving institutions that care for our children day in and day out? How do we bring them more fully into that and coming up with solutions for that? First responders, so this expectation of response after a major disaster within an hour or several hours. So that's what the community expects. The question is that realistic? Is that plannable? If that's something that is, do the plans accommodate that? If that's not possible, then maybe it's not a planning solution, maybe it's an outreach solution, maybe it's an engagement solution to make sure that people are not relying on that. And I would recommend starting with the most fragile populations that are the most vulnerable, where that delayed response from their perspective could lead to actually life-threatening outcomes. For child-serving organizations, really looking at your own plans for a disaster. Do you have evacuation plans, and do those plans include communication with parents and the surrounding community? Hopefully your numbers are higher than the national average in terms of parents and families that are aware of that. And if not, taking steps to increase that, because that'll be a really critical piece to ensuring the success of those plans when they're implemented. And finally, for individuals and households, preparedness is really the aggregate of the actions that are taken at the individual and household level. And really engaging and investing the time into connecting with the community and connecting with the first responders. I would say don't wait to be told how you fit into your community's disaster response plan. I would say go out and seek that relationship, ask those questions, and be part of coming up with the answers if those answers don't already exist. So that's kind of concludes what we have in the report itself, but I'm actually really excited to hand this over now to Erin Bradshaw to talk more about what this means, really from the perspective of the child, and really to hear more about what Save the Children does in the great work you do every day for disaster preparedness, response, and recovery. So I'll pass the mantle over to you.
Thank you. Thanks, Jeff.
Great.
And thanks, Lisa. So Save the Children is the leading global organization for children. We work in the U.S. and in 120 countries worldwide to make sure that every child has a healthy start, the opportunity to learn, and is protected from harm every day in times of crisis and for our future. Our approach is holistic, right? We work with mothers, babies, children, youth, and communities wherever they are. Right now, Save the Children is on the ground from Sudan to Syria, helping children deal with the shock of displacement due to man-made and natural disaster. And in disaster-prone areas around the world, we're helping communities better prepare to protect our most vulnerable citizens, our children. When disaster strikes, we believe children are the most vulnerable. And in the United States, 69 million children are separated from their parents during the workday. They're either in school or at childcare. I'm separated from my children right now. We know that children affected by large disasters are 5 times as likely to have serious emotional issues than those who were affected. Some extreme examples of what happens is that, following Hurricane Katrina, there were over 1,000 reports of missing children in the hours and days that followed that storm. And in the most extreme example, it actually took over 7 months to reunite the last child with her family. This is terrifying, right? And we want to do more to help. We want to ensure that communities can protect their children and therefore can recover more quickly, can bounce back more quickly. So we've seen firsthand what happens when disaster strikes. Since we began responding in the wake of Hurricane Katrina here in the United States 10 years ago, we've been on the ground more than 30 times. We've helped more than 1 million children and caregivers and parents in the immediate response and recovery phase. We led the presidentially appointed 2008 National Commission on Children in Disasters, and we serve as the national advisor to FEMA on children's needs and emergencies. We are the Red Cross's partner of choice, directly supporting children in shelters and responding whenever children are affected. From 2008 to 2015, our national report card helped draw attention and move the needle dramatically, encouraging states to put in place basic preparedness requirements, planning requirements for children in school and in childcare. We know that historically, children's unique needs were ignored in planning and in investment, and we mobilized to try to change that. So this girl on the porch here is a young woman named Jermizia. She's 9 years old, and she goes to school in Rowville, South Carolina. She's pictured here on the front porch of her family home that was heavily damaged following rains and massive flooding in the state back in October. She's out on the porch because her home is currently uninhabitable, or was at the time. And I want to read you just a brief excerpt from something that Jermizia's mom said when we met her after the storm. Everybody was just preparing for the rain. We just thought it would be a really bad rainstorm. I didn't really think too much of it. On the third day of the rain, everything on the roof started deteriorating right before our eyes. The floors began to get soaked. It smelled bad. It was just horrible. And at this point, we realized it wasn't safe, so we left. The next day, we came back thinking we could come back home. We came in, and it was like everything inside the house was raining. It looked like a rainforest inside of our house. So Save the Children and the community provided Jermizia and her mom with basic needs following that response. But the rural communities in South Carolina have a long road of recovery ahead of them, and so do communities in the Midwest that experience massive flooding this winter, and so do communities all over the country that experience small and sort of lower attention disasters nearly all the time these days. And the reality is that living in the United States, we are all vulnerable, and most of us have already been affected. This is just one snapshot view of a weather emergencies map in the United States, from tornado to hurricane to earthquake. And the reality is these colored zones are shifting, growing, and worsening each year. We think that communities and households have a responsibility to act because this is where we live. What's great about the project that we're working on side by side, the three of us, is that we're now learning from community projects in a proactive way, thanks to support. We are convening community stakeholders, creating networks, empowering local leaders to assess the needs of kids in emergencies, their readiness to meet those needs, and developing plans to ensure children are safe and protected and communities are more resilient. We're using an approach that was developed in the aftermath of previous disasters, bringing together community working groups after emergencies in places like New Orleans, Los Angeles, Oklahoma City, and Houston, Texas. But we're doing it before the disaster instead of in a recovery phase. We're working across sectors, engaging the whole community, uniting childcare, schools, health systems, and emergency management. And historically, that's where the gaps are. Emergency managers and folks who serve children or folks who care for children live in different worlds, and they speak different languages. So Save the Children is helping to build that bridge alongside our colleagues. The project is uniquely powerful because we are working with communities in a proactive way and seeking to build a replicable model for other counties to follow. We're helping them plan and consider children's needs before disaster, and inspiring a national discussion so that better practices can be in place for other counties proactively. The reality is, disaster can strike anywhere, anytime, and children are the most vulnerable when they do. The other thing we talk about is that disasters can be scary, but learning about them doesn't have to be. With this project, we're not only working at the community level with plans and systems and policies, but we're working with those child-serving community leaders and caregivers and equipping them with the knowledge, awareness, and confidence to teach home and family disaster preparedness to the kids they serve. We lead with fun, we run, we play, and we learn, and we teach kids how to know their risks, show them how to gather supplies, and help make a plan for their family. We remind children and caregivers that kids can remain calm and keep busy and follow the instructions of trusted adults when the unexpected happens. We know that a small amount of practice, discussion, and preparation can really limit the lasting effects, or we hope it can limit the lasting effects of disaster and trauma on a child's mind and development. What if together we could build a generation of children that are more prepared and more resilient, and over time, better able to bounce back themselves and help their own communities recover? So here's what you can do today, right? Disaster preparedness is a process, and we're really never finished with it. We need to be thinking about what is in place for our families all the time, but more specifically, and focusing in on some of the findings of the survey data, we want every parent out there to learn the evacuation and relocations plan for your child's school or childcare. We also want you to be proactive and sign up for the alert system, whether it's text or phone. Most programs now are finding ways to reach out to parents, but parents need to provide the information and opt in. We want you to update your emergency contacts, making sure that you have one in-town and one out-of-town contact who can be there for you if you can't get there, should you and your child be separated. We want you to practice key phone numbers with your child. This is a skill that I think we're sort of losing in the digital and cell phone age because none of us know our phone numbers very well. So practice them for your own knowledge, but really practice them with your kids and equip them to know how to tell a trusted adult a way to reach either you or your designated neighbor or contact or friend who could pick them up and be there for them. We also encourage you to make an in case of emergency contact card for your child. You can visit savethechildren.org/getready to make one on our site, but you can do this on your own. Make a simple card, put it in their backpack, have the same information on you and your spouse, and really be proactive about ensuring that you don't want disaster to happen, you don't want the unexpected to happen, but when and if it does, you and your family will be smarter about what to do next. Thank you.
So now I think we're going to get into the question and answer period and a little bit of discussion to conclude the webinar here today. So again, if folks have any questions that they'd like to submit, again, we encourage you to use the live chat on the YouTube channel, as well as to use the hashtag #SafeKids on social media. So some of the initial questions that have just come through have to do with really looking at kind of what is that ideal level of preparedness, right? And I think particularly as an academic institution, we get this question a lot, like what is that number? What is that target line that we do? And you know, I certainly have an opinion on it, but I'm curious what you guys think as well too in terms of sort of defining that number to achieve with preparedness. Erin, do you have?
I don't have the number. I also think we have to acknowledge that when parents are asked direct questions, we're probably inclined to make it seem as though we are more prepared than we are. I know I would. If I were on the phone, I may not want to face the reality that I haven't gathered all of these things or that I haven't understood what's in place at my child's school or childcare. So I think we might have to recognize that there could be a lower percentage in place and that we still have a long way to go. I would love to see 80% or more of our families saying they know and have their plans made. And I would love to see 100% of families having had a conversation with the people who take care of their children every day to know what that institution will do to protect their child and to relocate or evacuate their child if ever they had to.
And just something to add, of course, we would like an ideal level of preparedness, but what makes a difference is making progress over the years. So we're seeing a pretty slow increasing trend in the level of preparedness in the population. Ideally, we would like this trend to accelerate, basically improve the preparedness in a faster pace compared to what we have seen in the last 15 years. So if we take the necessary steps towards this goal, we may be able to see the result we are hoping for.
Yeah, and excellent points. And I think too that, you know, whenever we release data and whenever it's driven by numbers, there's always this kind of obsession over the precision. Is it 36% or 37%? Is it 60% or 61%? And I think the reality is for a lot of this preparedness work, and particularly when we're looking at opinion data, it's not about the number, it's about the trend. It's about the story. And if we saw that 40% of Americans had an appropriate preparedness kit in their home instead of just 35, would we say that we're doing better?
Maybe, but we wouldn't say that we were done.
Yeah, or that we were doing
Good
well.
point.
Yeah,
Right,
yeah.
right.
And certainly I appreciate that analogy to it being a cycle and it being a process. That preparedness isn't a destination per
Right.
se, but it's really like a healthy lifestyle. It requires certain actions that need to be maintained so that they don't go stale. Here's a question coming through now, actually kind of along the lines of what we're talking about that data and the precision. So we're seeing a lot of polls coming out now, right? It's the primary season. We're seeing a lot of obsession over margins of error and the level of accuracy and who's going to win what. And we're using survey data to capture opinions and things like that. How do we kind of reconcile the difficulty in getting precision with opinion data with some of the work that we're doing here today? Elisa,
this is a very good question. An important point that I'd like to make is that we're not aiming for an absolute precision. What we're aiming with this data is to demonstrate trends, to demonstrate an estimated levels of preparedness, knowledge, etc. So the survey is designed to capture the overall trends, to capture, as Jeff said, what we're observing over time, and the precision is good enough for the kind of information we're presenting in this report. So we're apparently comparing the data we have collected this year to data in previous years, and we can clearly observe certain trends over time. So even though data is influenced by current events, without a doubt, we are confident that we're capturing the overall picture, and this is what is important for this kind of research.
Absolutely. Great point. So also actually looking into how we measure things. So a good question that we have here is how we're actually measuring preparedness at the community level. I kind of glossed over that a little bit talking earlier on, but maybe we could talk a little bit about the Community Preparedness Index.
Yep.
So this is a tool that was developed, it's a Save the Children tool that was developed in collaboration with us at the National Center for Disaster Preparedness. And really what it is you take an inventory at the community level. It's a hard look at all the different structural determinants of preparedness. Are there identified leadership across different child-serving sectors? Are there plans in place? Are there exercises in place? Really going through very exhaustively. And so we're working with the pilot communities to actually run this index twice. So we're concluding it at the beginning of the project to get a baseline on where things are at. I think at the community level that becomes important because it really helps to provide some data for where to start. Where will you get the most outcome for the initial investment? But then also to do it at the end of the project to not only sort of set up that next sort of sustainability, where will the communities take it beyond that, but to measure the level of improvement, to actually be able to quantify it. Again, being careful with the precision question, but to actually be able to look at that and be able to measure how much more prepared a community is as a result of the work that was being done, and have that complemented by the stories and the good work that's being done there to really add some more validity. Erin, I know you've been a big part of a lot of this and the deployment of it. I'm curious if
Yeah, well, and I think part of the value is too, not in just sort of the scores that are generated, but in the learning and the process, and the fact that by using this tool and this instrument, you can have sort of a guided discussion with folks that you might not always feel comfortable or equipped to talk about or to speak with, or you might not have had occasion to speak with these folks who are in charge of responding to disaster or writing emergency plans. You're accountable for kids in your care all day long, and they're your primary focus, and that's appropriate, but the reality is we're asking these folks to look up and out and to be a part of the community system so that when the unexpected happens, that person can switch modes, so to speak, and really care for the children in their care in a different way and engage appropriately and do the right things so those children stay safe and are reunited with their family as quickly as possible. So I think it's because of the networks and the relationships that are formed through using the instrument that we see even greater value. And that's some kind of great feedback we're getting from the folks using it.
You know, one of the interesting things as we have these conversations with the different stakeholders is those moments where someone in a child-serving institution says, well, the answer to that question is no, we don't have that plan in place. And then somebody else says, oh, yes, we do. That score in that moment actually increases, not for methodological reasons, but because not knowing about a plan that exists is the same as that plan not existing. Right, and we find that there's a lot of great work that's being done in disaster preparedness. I mean, I truly believe that the reason these numbers are so low nationally is not for lack of effort, but for lack of connection and lack of building on different work, too much happening in parallel and not crossing over. And again, really just to the credit of the pilot communities in Putnam County and Washington County for really having the courage and the leadership to really step up and bring these sectors together and really blaze the new trail and figure out how to do this is
Right.
really a very inspiring thing to be a part of, I know, on our end. So,
Yeah. And for anyone who's interested, you can actually read more about the Community Preparedness Index by visiting SaveTheChildren.org with a /CPI. So.
Great. Yeah. So we have a few other questions here around. Here's one on. On the survey itself. So, I'd mentioned before we had used the random digit dial survey. And there are a lot of other methods of collecting information. We're seeing web-based surveys being used a lot more now. And the question is why we chose that methodology. Is it a question of accuracy? Dr. Petkova, do you want to talk a little bit about that?
Yes, so one of the major reasons, of course, it has been tested in the past as a very good methodology that we have employed previously. The reason why we continue using the same methodology is consistency. We want to make sure, this is extremely important in this kind of work, that we can trend responses over time. So employing a consistent methodology over the years makes this possible. Now we realize that web-based surveys are emerging as a new way of carrying out this kind of research. And there is still not enough information of how comparable data is when it's collected from web-based surveys compared to random digit dial surveys. So this is an area of work for our center to carry out parallel surveys using different methodologies to make sure that we can actually in the future employ different approaches and assure that we can still trend responses over time. But since this is still work in progress, for this report, we have decided to stay the methodology that we have employed over the years.
Yeah. I think this also plays into our earlier discussion about the precision of the data, right?
Yes.
Is that when you're trying to forecast who's going to win an election, precision has a different premium on it than if you're really sort of looking at sort of those trends and these things where, really sort of capturing the current state of attitudes and opinions of the American public and how that integrates with what we do.
Yes.
Again, the difference of 5 percentage points could be an election, but in this case, it still means that levels of preparedness are extraordinarily low.
And we have a lot of work to do. So.
Yes. But again, I think the great thing is that there are a lot of great people out there really doing great work, and I think that the purpose of this initiative and really the work that all of our organizations do is to make sure that the best tools are available to help people move the needle on these important issues. So here's one about how do I even go about connecting with emergency managers in my community? And I think that that's a really great question because there are different groups along this continuum sort of work with different players. Emergency management oftentimes coordinates among other organizations, and it's the organizations that they coordinate with that oftentimes work with individuals directly and work with children directly. But I think that the first thing to do is for an individual living in a community is first find out who your emergency management agency is, who your emergency management contacts are. I've had the privilege of working with a lot of emergency managers, and everyone I've met has valued the importance of relationships and the importance of those connections. And I would call them up, email them, look at their events, find out what their events are for engaging the community, what opportunities you have to engage. But I think that there's also an opportunity, and I'm curious, Erin, for your thoughts on how folks can engage the organizations that serve their children and sort of also help sort of steer these different sectors together.
Yeah, I mean, I think it's an intimidating question to go to your child care provider or to your school principal and say, hand me your disaster plan. But I also think it's a question that we should all feel a little bit more confident and be willing to ask. Find the right venue.
Yes, sure.
Maybe pull someone aside, or maybe write it in an email. But say like, hey, I saw that there's an issue that we as parents may not know enough about plans to take care of our kids, and I would love to know where can I find or where can I read the plan specific to where my child is every day, and be the one to start the conversation. For those of you who like a tool or a tip sheet, there is again one on SaveTheChildren.org/getready. There's actually a basic checklist for child care providers, and it's meant for them, but you as a mom or dad, there's no reason why you couldn't bring that and offer that to them as a tool for them to use. And Save the Children is at the forefront, along with other agencies, of really trying to improve the quality of childcare emergency preparedness in particular, in the wake of a major passage of federal legislation, the Child Care Development Block Grant that was passed 2 years ago and is going to effect in the coming year. So we are really trying to influence kind of at the middle level to make sure that those child care providers get the right level of training and that it all kind of works from the top down. But I think parents can help to make change really from the bottom up just by asking good questions. And you can do it in the most generous way, saying like, look, as a mom, I don't know, can you help me? And hopefully your child care providers will welcome those questions.
And I think that's one of those things I'm really enjoying about the partnership with Save the Children, and sort of all of us sort of operate on different levels, sort of working from that high altitude elevation of national policy all the way into the community and the child serving institutions, and being able to see firsthand the prep rally trainings that Save the Children does. And I think one day we're going to have to put up a bloopers reel for this project, because we have some video from the training, and it's
the whole point is to have fun.
Exactly.
So you know,
it was,
mistakes are good opportunities to learn, right?
Yeah, absolutely. It was one of the most fun trainings that I had seen. And again, it's important that again, different audiences require different things, right? Emergency managers who are coordinating among organizations require strong coordination language and strong coordination procedures, whereas at the individual level, it's a lot more about checklists and conversations and things like that. And it's really great being a part of this partnership to kind of demystify that for the different levels.
The other thing I would say is that simple actions can accumulate to progress. So writing an emergency preparedness plan for your family sounds massive to me. It sounds like there's a lot of shopping and preparation and photocopying of important documents. But I think what we want to say to parents is that start at a place where you feel comfortable, start at the most basic place, and every step you take to get smarter, to be more knowledgeable, to talk to your children, to even just talk to your neighborhood about what might be a relocation place, that's really, really good progress. And then you can move into your disaster plan supplies and really thinking about that, you know, sort of as you get more and more confident in this space. But we're asking you to start, and we're asking you to start today.
Yes. No, and you know, that's a great point too, on just the connectedness of a community and working with other community members. We had a barbecue a couple of years ago, and I gotta tell you, I knew probably more than I ever wanted to know about my neighbors after that. But the reality is that the next time that the power went out and we saw them out there and we're chatting it up, what's going on, we went over and knocked and checked on each other. And there's the kit for your own personal preparedness, and then there's that community level kind of bringing folks together to talk about these things. So we do have another question coming in, looking at kind of what areas, what states were targeted in the survey. So for the national level survey, this was actually weighted against the census data for region and geography. So it wasn't targeting any specific state. We actually took great pains to make sure that it really crossed all of the states in all different geographic areas, rural and urban and suburban, to be in line with the census data on that. But it is worth knowing, too, that we are also providing additional data to the communities that we're working with in Putnam County and Washington County, so that they have that more community-specific information to be able to develop their own planning and outreach with as a resource for that. Great. So I think we have time for maybe one or two more questions. So we have one here. This is a tough one. Policy change around community resilience seems like it falls very low on the policy agenda. How can we change that? Do one of you guys want to take that one on? Yeah, I'll start just a little bit on that. And that, you know, politics and emergency management are very similar in the sense that it's all local. It starts with local action, local advocacy, and first and foremost, advocating for yourself and getting involved, getting involved with the discussions for this. I can say that, you know, we've wrestled with that question ourselves for this initiative, and how do we make those connections, and that's where the establishment of the National Children's Resilience Leadership Board that we'll be developing on this project is so critical for making sure that we actually have a vehicle for translating the great work that's being done at the community level into those policy discussions, because they operate very differently. I don't think it's an antagonistic relationship. I think people just work in different languages based on their field. Right. And a lot of times that translation doesn't occur.
Right.
Do you have thoughts?
Well, I mean, I think one of the things I'd love to see is more investment dollars unlocked for preparedness work. I mean, I think this project, as I said during my talk, is really, really unique that we're getting to work with communities, not because they've just been blown away by a tornado or hit by a terrible flood or something else, but because they might be, and they want to engage in this action. And so I think the donor space, whether that be corporate partners or foundation partners or the federal government, beginning to look and resource projects in this way, will be one of the ways that we make this change and that we're able to do more in advance, and that communities can take it upon themselves to build their own resilience. Because the reality is, when a disaster strikes, most providers are not there for very long. It's an immediate response, and very, very quickly that community is left on its own to deal with the aftermath. And so it'll be projects like these that help our ever-changing world, where more and more, as I said, lower attention, smaller disasters seem to be happening more often. It will be those communities that find ways to think about resilience in advance that really become the strongest communities afterwards.
And just something to add, apparently this is never a one-size-fits-all approach, because every community is so different, and this is why projects like this are so critical to really accelerating the policy agenda around community preparedness. Because once communities are empowered to derive their own strategies and plans and are really aware of the issues that are important for them, this is when they really can take action and really be part of the conversation and make a difference.
Yeah, these are all just excellent points. And I come from a public health background, and this disaster response field reminds me a lot of that too, is that if you're doing your job really well, nobody makes a movie about it. It's very difficult to measure when things are done well.
Right.
And when a community isn't as adversely impacted because of the work that it's done to prepare and mitigate against disasters. And that's where measures, some of the work that we're doing with the Community Preparedness Index, to try to start to really populate the evidence base with some information on how to quantify that and how to measure that. But I think it also, it does just take ongoing individual action and discussions at the national level to just continue to remind ourselves that a sunny day having a picnic in the park is the desired outcome of preparedness. And it doesn't make for good TV, but it makes for good communities.
Yes.
So with the couple of minutes that we have remaining, I just want to go around and say a couple of rounds of thank yous. First and foremost, I want to thank all of you, our participants, whether you're participating in the live stream or watching the recording after the fact. We greatly appreciate the time and attention that you're giving to this important issue. I'd also like to encourage you to continue the conversation on social media using the hashtag #SafeKids. For those of you who are interested in following the project and learning more about it as we go through the initiative, you can access it through the website ncdp.columbia.edu/rcrc. There's also a link to it on our main page if you want it. For folks interested in these individual tools that Erin talked about made available by Save the Children, you can go to savethechildren.org/getready to directly access these, and we also have a link to them on our project site. I'd like to thank our panelists, Erin and Elisa, for all of your thoughtful insights and work, as well as both the teams at Save the Children and the National Center for Disaster Preparedness on this initiative and the amazing work you're doing on this and so many other initiatives. I'd also like to thank Columbia University and the Earth Institute for giving us a home as a center and really valuing an impact orientation to pivot from the evidence base and the scientific work that's done. Also to the counties in Putnam County and Washington County for all of the amazing work that you do every day, not only on this initiative, but for your communities and for really serving in a leadership role for other communities. And finally, I'd like to thank our funders at GSK for recognizing the importance of these issues nationally, for taking a proactive approach to solving them, and really for supporting this partnership that recognizes that the best way to truly serve the needs of children in a disaster is to prevent them from having to become victims of one. Thank you, and be safe.